I would like to welcome the ACS members to the American College of Surgeons Pathways to Fellowship series. I'm Lyndsey Kilgore, a breast surgical oncologist at the University of Kansas Cancer Center and an associate fellow member of the American College of Surgeons. The committee has developed this new Fellowship Pathways series to spotlight surgeon leaders who have championed the pathway to fellowship to young surgeons. The goal of the interview is to help promote the value of fellowship within the ACS and among its members, especially those in subspecialty fields of practice. This interview will be published in the Resident and Associate Fellow newsletter and will be made available as a podcast accessible from the ACS website. Joining me in conducting this interview today is a medical student committee member, Haley Nadone. Haley, would you please introduce yourself?
Hi, my name's Haley. I'm a second-year medical student at the University of Nevada, Reno.
Great, thank you. Well, Dr. Kenton, we'd like to begin the interview with you. Would you mind telling us a little bit about yourself?
Sure. I'm Kim Kenton. I'm a fellowship trained in female pelvic medicine and reconstructive surgery, and I'm the chief of that division at Northwestern University. I've been a fellow of the American College of Surgeons since I first got board certified and was able to join the ACS. I'm also the American Board of Obstetrics and Gynecology's representative to the OB-GYN Advisory Council for the ACS.
Great, thank you. We're so excited that you're here.
Thanks.
Dr. Marchand, would you please tell us about yourself?
Hello, I'm Greg Marchand. I'm director over at the Marchand Institute for Minimally Invasive Surgery. I am fellowship trained in minimally invasive gynecologic surgery, and I'm also the interim fellowship program director. I'm a member of the American College of Surgeons Advisory Council on Obstetrics and Gynecology, and I'm also a member of the American College of Obstetrics and Gynecology, and I achieved my ACS fellowship just a few years after becoming board certified.
Great, thank you. We're so excited to have both of you. Could you guys please tell us a little bit about what ACS membership means to you and to your institution?
So really being a member or fellow of the American College of Surgeons has been it's opened a lot of opportunities and doors for me. Having my primary certification in OB-GYN and then female pelvic medicine and reconstructive surgery, and also belonging to all of our subspecialty and specialty societies. Also being a member of or a fellow of the American College of Surgeons has made me the logical liaison for many of my national roles in OB-GYN with surgery. It's allowed me to participate in the ACS's surgical summit that they've had for the last several years in May, where they bring all the surgical societies together to talk about issues around residency and fellowship training. And I was on the Accreditation Council for Graduate Medical Education and was the natural liaison for the ACS for that meeting. Again, being for my role in the American Board of OB-GYN and also being American College of Surgeons, it made me the natural liaison for being on the Advisory Council. So in addition to all the great educational opportunities it's created, it's opened a bunch of new doors where I've met new people and probably interacted with other surgeons and other specialists who I wouldn't have necessarily interacted with without being a member of the ACS.
For me, ACS fellowship, it really means a lot to me because fellowship is one of the few aspects that differentiates me within my field from those who might be doing a lot of very meaningful work that might not be very surgical. I think OB-GYN has one of the widest ranges of different types of career paths you can take. And I personally know very many OB-GYNs who simply don't do any surgery or maybe do an occasional C-section, but really don't have a big part of their career dedicated to surgery. Well, I'm sure that's wonderful and fulfilling for them. It's not the path I've chosen. And as a result, my fellowship with the College of Surgeons relates a lot more closely to what I do on a day-to-day basis in the operating room than, say, for example, my fellowship with the American College of Obstetrics and Gynecology. This is true at my institution as well. I think those of us at the Institute who are OB-GYNs, but we tend to put FES after our names instead of FACOG, are making an outward sign that the surgical aspect of our career is very important to us, and we're probably more of a surgeon than a baby catcher.
How have you championed ACS fellowship at your institution and within specifically your guys' subspecialty?
I think within my institution, since coming to Northwestern, I've really gotten a lot of both my division, so the other women in female pelvic medicine and reconstructive surgery, one of the GYN oncologists and actually the minimally invasive gynecologist to broaden their horizons. And actually many of them are now are fellows at the American College of Surgeons too. I think one of the things that's made it easy to try to get people on board with becoming a fellow of the ACS is, as many of you probably already know, that the American Board of Obstetrics and Gynecology made passing the fundamentals of laparoscopic surgery offered by ACS a requirement for certification. So now in order to be certified in OB-GYN, one must have pass FLS, which has really been great because that's in addition to that great laparoscopic training for certification, it also has opened the eyes of many obstetrics and gynecologic surgeons who otherwise weren't thinking about FAS and realizing all the educational opportunities that it offers.
Well, yeah, that's basically the way that I feel. It's probably a little different at my institution because we're a private institution, so we don't have as formal departments. But I'm definitely a strong proponent of ACS Fellowship. I strongly encourage all of our residents to consider ACS Fellowship as soon as they become board certified, and all of our MIGS fellows. Some of them already come to us board certified. Some of them get board certified during the fellowship. And I recommend they immediately begin the process of attaining ACS Fellowship in addition to ACOG Fellowship.
What would you tell your 20-year-old self at the beginning of your career about fellowship in the ACS?
Wow, that's a long time ago. Like I mentioned earlier, as soon as I was eligible to become a fellow in the FAS or in the ACS, I became one. And a part of that was from some great sponsorship and mentorship I got from my mentor, Linda Brubaker, who was a fellow in the American College of Surgeons. I think that things that I might do differently is I would probably get more involved earlier. I think that it took me till probably, although I was a fellow, to the second half of my career when I was more in leadership positions, and I started looking for resources when I was residency program director. Even before it was a requirement, we started instituting FLS in our residency program. And I even had my OB-GYN residents, when I ran a program, do the kind of didactic modules. I forget what it's even called now. That you have the surgeons do. And while some of it is probably esoteric for OB-GYN, managing surgical complications and comorbidities is the same whether you're practicing orthopedic surgery, obstetrics and gynecology, or general surgery. And there's so many tremendous educational resources that I wish I would have probably taken advantage of even earlier in my career.
Yeah, I feel like exactly the same way. The main thing I'd want to tell my 20-year-old self is to realize how important ACS Fellowship is going to be as a tool to guide you through your career. Early on, the college gives you many ideas of where to take your surgical practice. Some of these directions you might not even have considered. Later on, fellowship puts you with a group of surgeons that really gives you firm anchoring to tell you where your subspecialty is going, what advancements your colleagues are making. And then this really makes it quite easy to perform self-assessments to see where you are in this group of surgeons. And that helps you maintain confidence in your surgical practice. I'd probably also tell my 20-year-old self to buy some 8 cents Apple stock and look for something called.
Oh, those are great pieces of advice. Could you guys give us 3 just kind of takeaway points for our surgeon colleagues on how they can address their career path and membership in the ACS?
3 takeaways that I get from being on the advisory council and being a fellow of the American College of Surgeons. Number 1, for an OB-GYN, don't be afraid to be an OB-GYN and a surgeon. It's okay to be a competent obstetrician and to put your focus, to put your life's work into surgery. There'll still be doctors to catch the babies, don't worry. Next, you've got to find time to get involved. You've got to make the time to get involved. Advocacy and research are very important parts of your surgical career. Of course, patient care is going to take the forefront, but make time for advocacy and research, and the American College of Surgeons will be a great way to help with both of those. Lastly, you don't always have to be on the cutting edge of surgical technology, but it's good to know who is and what they're doing, or at least what they're trying to do. An ACS Fellowship will put that kind of research at your fingertips so you can see where your colleagues and where your specialty is going.
Yeah, I kind of echo everything that Dr. Marchand said as well. I think a couple other kind of things that I think are important that young surgeons should kind of keep in mind, particularly coming from OB-GYN backgrounds, is that obstetrics and gynecology is a surgical specialty. And while we have some unique aspects of our field that get met by the American College of OB-GYN, or even societies like the Society for Gynecologic Surgery, many aspects of surgery are like homogeneous, no matter what your subspecialty or specialty. And I think that what the ACS does is it brings us together as surgeons in a way that many of our OB-GYN societies don't do, probably because they're more focused on advocacy, as Dr. Marchand said, around surgery. I also think that keeping like our eye on the ball and realizing that, you know, we need to keep our identity as surgeons, and we need to know what the other surgical subspecialties and specialties are doing with regards to training, innovating, and, you know, in many ways, I think that American College of Surgeons is better able to focus on just the surgical aspect of our field, where I think much of what we do in the broader like aspects of OB-GYN can often get focused on obstetrics. And that's really not the majority of what we do. We need to keep the focus on both. And quite frankly, even obstetrics is a surgical specialty. I mean, they do a lot of surgery in OB. I always say that we're going to be the last surgeons who know how to do a laparotomy. And the general surgeons are going to have to come to rotate on OB to do a laparotomy, because you're never going to be able to get a baby out minimally invasively. So I think it's a really important adjunct to the American College of OB-GYN for, you know, board certified obstetrician gynecologists and gynecologic surgeons.
Well, thank you guys so much for taking time out of your busy schedules to do this interview. I think you said it, very well, that, we really need to take into account all these different surgical subspecialties and get more young surgeons involved in the subspecialties into the American College of Surgeons, because of all the great resources, connections, research opportunities, everything that the ACS can offer them. So thank you for shedding light on that. And thank you again so much for your time. We really appreciate it.
Thanks for having us. It was our pleasure.
Thank you for having us. Appreciate it.
Thank you.